All righty. So let's get started, man. I think what we should do is just have a podcast where it's just a conversation, talk about life. We don't have to always talk about medical stuff, but, fitness. I know you're a huge buff guy.
Yeah, I guess.
That way
I know a lot of friends that are trainers, nutritionists. Obviously, we have a big circle of knowledge, right?
Absolutely.
Each of
Yeah,
us is
no.
like a little web of information.
You mean
Uh,
nutritionists who are doctors or?
yeah, yeah.
Yeah.
When I started tuning into this naturopathic, holistic, side of medicine, I started meeting all kinds of people in that space. You
Yeah.
know how it works. You kind of manifest the things you're thinking about.
Law of attraction,
Yeah,
absolutely. I thought medicine and surgery was end all and be all. And
yeah,
then as I actually started practicing, I realized, man, it's not really curing the source of the problem. I'm just putting a Band-Aid on with the medications and all
yeah.
the surgeries. Yeah, and it kind of made me realize, wow, preventive medicine is important. But more importantly, there's so many things that people can be doing to stay healthy.
Yeah, I mean, that's kind of like the key principle of the way I practice. Part of it is because I'm a DO, so we're like programmed for that, that the body can heal itself. But I really believed in that when I applied to medical school. So I really, just seeing it from my own body and seeing other people, like being a kid playing sports, if I get hurt and I do what the doctor tells me or the right way to take care of my body, it gets healed. My body's always been honest with me. So that's kind of how I elicit knowledge from watching that my whole life. And then I see like my patient, okay, clearly this patient is not getting better because some other issue, or they're just not getting it, or I didn't explain the issue properly. Maybe we're not explaining things as well. So maybe initial old school medicine was like, doctor says something and then you authoritatively answer, right? Maybe now in being too chill with them, we're not really explaining the disease and how serious it is and, having a longer discussion of what's actually going on rather than doing what our brain wants to do, which is, remember, it's like signs and symptoms, complaints, and then we get the differential diagnosis, right?
Right.
And then we're like, they're talking, we're eliminating, okay, you need this, we will bring you this. See
Right.
you later.
Right.
This thing will be replaced by a robot like that.
I've heard that
So it's not even a sustainable model in that sense.
Oh,
But I've said
absolutely.
enough. I want to hear your words.
No, absolutely. On the last point, I've heard that ChatGPT was able to, have a better accurate diagnosis because it can tap into the whole database of all the pathology, everything that we learn and memorize. No, obviously not in surgeries wise, they can't do surgery, but in terms of differential diagnosis, symptoms and diagnosing what the problem is and recommending, treatment options and preventions, things like
You
that.
know what? You said something very interesting right now. You performed surgeries for a long time until you like kind of, I don't know, I'm assuming some of this, like you honed in on like the procedures you did, with other risk factors, risk benefit, financial goals for it could have been a million things that kind of tweak your career. You know what I mean?
Yeah.
Did you ever think that your skills, your procedures can be replaced by a machine? Like honestly, certifiably, like replaced by a robot surgeon?
I never thought that.
Okay.
But I mean, I do know the robotic surgeries are out there, but it is difficult.
Yeah.
And the reason is, okay, so for example, radiology, diagnosing images or detecting cancer or something like that, the AIs, the machines can tap into the database
Right.
of billion terabytes or whatever data it has, far superior than human being. Even the robots, the robotic surgeries, it's the human that has to use the common sense
Yeah.
and minute by second, small vessel bleeding, those kind of
Yeah.
emergencies. It's just like a Tesla car. Hey, even Tesla does not allow you to have a full self-driving, even if with its database of all the roads and conditions
Yeah.
and driving
No,
skills.
it will make weird mistakes. and
Yeah, maybe you'll get there. Who knows?
Yeah.
Who knows? But I mean, kind of going back to, what we're talking about, the philosophies of medical treatments. I mean, coming out of med school and coming out of residency, I thought, you know what, I have a solution for everything. I chose surgery because we could fix the problem and be done with it. But I realized it's a snapshot of a patient's condition that has been progressing for 10, 20 years. For example, peptic ulcer disease, or some kind of a big hole in the duodenum from the stomach acid.
Yeah.
That's been going on for years, and they just been masking it with medications or trying to do other things and saying, oh, just don't eat spicy food. But ultimately, it's really their mindset that's leading to it. They're more anxious. If someone's anxious, they're worrying all the time. Thoughts become their emotions, and that manifests in our body. I mean, how many patients have you seen? You're an interventional cardiologist. You fix the arteries, so when they have heart attacks, or you can prevent the heart attacks or chest pains. How many times have you seen those patients keep coming back because they haven't changed their lifestyle or their mindset or how they approach their life?
Yeah, well, my patients don't keep coming back because they listen to me. I'm kidding. Of course, it's, different patients take longer time to get on board with certain things. I mean, a lot of things become repetitive and you get bored with it. And then this is where we're talking about looking at the bigger picture, right, of medicine. I guess that's one of the purposes of this podcast, is to maybe illuminate some medical issues.
Well, I mean, what's the name of your practice?
Oh, my practice, it's called the Heart and Wellness Center.
Why did you put wellness there? That was what was interesting about it.
I wanted to give the vibe of the place that it's wellness, because I could see having a bigger, audience than just cardiovascular patients at some point, maybe.
Yeah, I think a lot of doctors, I think it's important for us to use what we've learned in our actual practice and to offer more services like that. For example, in my case, I mean, like, one of the biggest things I always emphasize to the patients is exercise. Exercise and moving your body, pumping the blood through, maintaining your muscle strength. How important is that for cardiovascular health?
It's really important. I mean, is there a way to bring up my website while we're talking?
Oh, absolutely.
Man, have you done a podcast before?
Oh, tons, yeah. It's a platform to really get our voice out there. Too many people are hearing all these negative things from different doctors and that are very not conducive to health and wellness. And it's not just surgeries, and we don't just throw surgeries or medications to people. It's the preventative care. What supplements do you take?
Oh, this is a great topic. Let me get to the first thing. Yeah, do you have any supplements that you've been recommending recently?
Oh, absolutely. There's a core things that I take. Multivitamin, I take Animal Pack, which has just everything, literally, minerals and whatever you need, selenium, like everything that you possibly need it's in there.
All right, so selenium, what else?
Well, I mean, Animal Pack has everything in there. That's, all the minerals too. And then I take the fish oils, and then glucosamine. I take fish oil for more of an, anti-inflammatory.
What was the dose on that?
I don't really focus on that. I don't know. I just take 2 or 3 tabs that they recommend.
All right, there's a pyramid I'm trying to get to. So right there on the bottom. So you got to decide, right? We're always telling patients all these things like, do this. But it's good to know what's the most important thing, right? What do you think the most important thing? I mean, obviously, if you see my pyramid, I think exercise is, but would you agree that's number one?
Absolutely. Most important thing is exercise and fitness and moving the body.
Exactly. Basically, that's one of the definitions of life is mobility. Basically, every freaking creature, single-celled organism, it was all about mobility. That's literally how they evolved into other species and spread around the world and let us come about. So yeah, mobility is very important. And then they're going to hear a lot of conflicting ideas, like how do this, do that. And I got a really good story about this, but I'm going to have to grab some water. 1 second. About 2 weeks ago, I was covering STEMI-Call up in Cottonwood, and we had a 29-year-old come in with a heart attack. STEMI. 29 years old.
That is ridiculous. Oh my God.
So this young man who was not morbidly obese, his story was he had been diagnosed with hypertension and hyperlipidemia. But he wasn't like one of those that you would see like disheveled. He looked fine. You know, he didn't look terribly ill. And he came in, he's like, I'm having chest pain. You know, I saw him, he's like, I'm having 5 out of 10 chest pain. It was worse a few hours ago when he was doing a HIIT class for the first time ever. He's trying to do his 30 to 60 minutes, you know, he's trying to be healthy. And he wasn't otherwise completely sedentary. Because I had to know, like, why is this a 29-year-old having a heart attack? How many people would have done that? You know what I mean?
Not at 29 years old. They wouldn't suspect it.
Not at 29 years old. You know what I mean? So he's an intelligent person and like I'm worried about himself. So all these things like really impressed me about this.
How bad was hypertension? It must have been pretty bad then.
He was on a low dose ACE inhibitor.
Okay. How come? How come? You just referred.
How come?
Yeah.
Number one, there's a chance that they will cough. All right. People already are they're sick of medications, right? Yeah. So you're going to give them a 5%. It's like Brilinta. They're going to get short of breath. It's like a very common side effect, you know. So those kind of drugs, I just don't use them. Yeah, I've never prescribed lisinopril. I like the ARBs way better, you know. You don't hear a lot of people with ARB allergies, right? But a lot of people have ACE allergies. But then if you get away with the ARB, you're fine.
There's, every medication has potential for side effects, and people don't realize that side effect will cause more problems that you have to take more medications for.
That's true.
And it's just like a cascading, snowball effect. Like,
that's why some people don't want to take any meds. That's why a lot of people don't want to take any meds. They want to use like so-called natural things like red yeast for cholesterol, which actually has homocysteine reductase inhibitor, statin, like drug in it. This is the bad side of what I think is like alternative medicine. You can only go so far with that too. Like if someone has cancer, they need chemo, radiation, and obviously a complete change in lifestyle, Zen, find God, find peace. Generally that's what cancer is about.
Yeah, no, I agree with that. I mean,
but they can't take vitamins for that shit. You know what I mean? Like,
it's got to be a total approach. Right, we're not talking about whether Western medicine has any useful effect at all. No, absolutely essential. Like if you got cancer, you need surgery to remove it. You need chemo, radiation, whatever. In addition to that, they need nutrition. They need relaxation. They need meditation. They need spiritual help. They need exercise, fitness. All those have to come together. But obviously, because of our training, we only focus on what we know, which is surgery and medicine and things like that. But it's not like doctors don't want you to do all the good stuff, but people just don't hear that from us because we don't have the time, and we are pressured by insurance companies to see more patients at less time. There's just not enough time to educate the patient unless we do a forum like this.
The education is completely different. We're about the same age. That means when we first started practicing, and the doctors before us, they were talking to patients that were either uneducated or very well educated, and there was like one set of knowledge that we can both agree upon, the patient and the doctor. But since then, now patients are either uneducated, and I don't mean that in a derogatory way. I mean like unmedically educated. They don't know the lingo. They don't know the stuff. That's all I mean by that. And then there are those that are miseducated. That the YouTube consultations and the Google consultations, which both are great tools, and I use all the time. Half the stuff I watch in general, half the media I consume in general is from YouTube, because there's like amazing interventions filmed there. There's some really good surgeries. Like you can see what's going on with, in some aspect of the community that posts stuff online. And it's a wonderful tool in that sense. But also patients can go down these rabbit holes where they end up with weird diagnoses, undue stress, and then we have to undo the misinformation and replace it with what we know is true, or as far as we know, we don't know anything absolutely.
It's not something that can be regulated, because information should be free to everybody. Mm-hmm. Obviously, there are going to be quacks out there on social media that are unlicensed, that are just coming up with just far-fetched idea about healing and what to do.
No, I like to always think of like the other side's perspective. From the other side's perspective, medicine has been too authoritarian and too like rigid. Okay, so it was due for a relaxation or whatever you want to call it. Okay, it was due for some reformation. But it's just like the patients, you know, they can pick and choose their information. You know, there's really no absolute source of truth anymore. You know, I think one of the worst things that happened with the pandemic, and we won't get into politics on this this broadcast at all, but one of the biggest things that happened during the pandemic that I noticed was like a psychological shift. Forget about the mass deaths and mass information that we had in that time, but basically that we saw medicine become completely politicized. And once that happens to any field of knowledge, then you're right. You should not trust what comes out of it anymore, because politics is by definition not science-based. You know what I mean? And not solely created for, you know, for good patient outcomes, which is what medicine's supposed to be. You know what I mean?
Yeah, you know, I think my solution to that is doctors who have experienced a lot of things and have a big, wider vision about a health and healing should talk more. Should just be out there saying, hey, you know, this is what we've learned, treating thousands of patients and observing all this pattern and going, hey, you know what? Yes, it's okay to get your advice from WebMD and online, TikTok, YouTube, Instagram. It's okay, but balance it out. You know, listen to many second, thirds, fourth opinions and really distill this information and think logically and rationally about, hey, what is the most rational and logical advice? And not fall for like a sales gimmick, like, oh, take this nutritional supplement and you'll cure everything. No, that does not exist. Those things never existed. Good health always comes from hard work, effort, and discipline, which is exercising, eating properly. I mean, if we're eating crap all day long, I mean, we are going to get sick.
Yeah,
that's just given. If we're stressing ourselves all the time, if we're getting angry, I mean, I can't tell you how many angry alcoholics that I've treated that had GERD and that just ruptured, you know, duodenum from all the acid. It's like, chill out, bro.
Yeah,
chill out. What you do is stop getting angry. You know, figure it out. Get some help, and then your body will get better instead of being all these Prilosec, Prevacid, you know, and surgeries, Nissen fundoplication, all these things. Like, God, it's a fixing the problem. It's like a fixing the car after it got into a car accident. Just maintain it. Maintenance goes a long way. You know, engine oil changes, tire changes, filter changes, you know, all those things we have to do for our bodies as well. And that means, you know, getting your mindset right, getting your emotions straight, you know, avoiding really harsh conditions and stresses, spirituality, you know, whatever can help the people. I think that's going to be our solution to people. It's not going to be like any political regulation of social media content, or because information is free. Information is free and readily available, and it's only going to be, you know, doubling every month, every week. You know, we can't control that.
If you had any like spiritual routine that you do regularly?
Oh, my routine may sound pretty far-fetched though, but it's based on scientific evidence. A lot of the people who have proven track record. So my morning starts with eating a breakfast with 6 raw eggs with the protein powder shake. That's my breakfast.
You put the raw eggs with the protein powder?
Yes, all mixed together with water. Yeah, I just, you know.
And water? So what does that taste like, dude?
I prefer chocolate.
So when you put the eggs in there, okay?
Yeah.
With the chocolate, how do you know that when you spit them that fast, you're not destroying the protein that you're trying to get?
You mean when I shake it?
Like it's a shaker. Okay.
Yeah, it's a shaker. I mean,
I would have done the ninja.
I don't really worry about that. Like I know I've read it somewhere about that. Like if you do a lot of blender, sometimes the actual things or heat or microwave can destroy it.
Yeah, exactly.
Worry about things like that. I just focus on, hey, what can I eat?
So you shake it up. How many eggs did you say? I'm trying to get an idea of how much protein you're getting.
6. I get about 200 200 grams of proteins a day.
Oh my
So
God.
6 eggs, a scoop of protein, which is about 20, 25 grams. That's the morning.
Yeah,
And
what
then
you just described was almost like 100, right?
before, my cholesterol level was super high, and I couldn't understand it. I was stressed out. I wasn't working out. I wasn't exercising. After this change and adding the exercise to actually burn off all those calories and things like that, my cholesterol level, perfect.
So you eat 100, about 100 grams of protein. And like, if I was to eat that, my stomach would be very upset in the morning. So is it just something that your stomach got accustomed to?
Yeah, I got used to it. Obviously, the whey protein can give you
Yeah.
diarrhea and bloating.
Yes.
I started slow. It wasn't big. And then, initially I started with like 2 fried eggs and some toast and things like that. But I gradually upped it because I realized, man, I feel so much better, so much more alert, less hungry, more energy when I get to this level. I left the home pretty early, but man, that moving to America stuff it's wild, man. It's very memorable. It's like weird. It's different. It's scary. It's let me tell you. So you were like 10 or
I was I think I was 7 or 8.
7 or 8? I was 14. Okay, yeah.
Yeah.
Man, what an
Oh man,
experience.
so they boarded you up right away. That was a good move.
Yeah. Well,
I think that was a good move.
Yeah, one of my cousins, I think they went to that boarding school, and my parents were concerned that, you know what, I'm not really adjusting well. I'm not going to learn English unless I immerse myself away from any kind of Korean communities and just focus on studies. So that's what they did, and all I did was nothing but study, work, study, work, study. And then,
Did you do your whole high school boarded like that?
yeah, pretty
Yeah.
much entire high school.
So was it like a male school?
No, it
Male
was
and
it's a co-ed, but then, they had pretty strict rules. It was a Quaker school, so very traditional, very old, yet but liberal-minded. It was
So
amazing.
that seems like a place that would give you a lot of discipline. Do you attribute like learning discipline there?
Oh, absolutely. Absolutely. They had strict study hall time, 7:30 to 9:30, 2 hours. And then 10:30, it's the lights out, classes on, all that stuff. But, I think I was very hungry. I was very ambitious. I wanted to do better for myself.
Really?
Yeah.
Like,
Even at that age,
what does feeling hungry at 14 look like? I can't even imagine it.
because I didn't like my situation. I hated the homes and, what we had and what we didn't have, and just feeling the lack, feeling
So
like,
you had like a fire. You had like a fire to get things going, huh?
yeah. It's like, you know what? I don't know when it was. I remember kind of talking to myself, like, you know what? No one's going to come to save me. No one's going to do the work for me. It's either I make it happen.
What age did this happen?
And after that, I don't remember exactly. It's not like I write it down and.
Honestly, like I just came to that realization.
Oh my God! Really?
No, I mean I haven't been like holding out in general for someone to save me, but it's kind of like let the universe kind of guide you, I guess to a point.
Yeah.
So that's cool. And then you went to Cornell, and then where'd you go to medical school?
New Jersey Med School.
New Jersey.
In
You went back and forth?
Well, after Cornell, I worked in, what did I do? I went to Penn, and then I did a year of work in Manhattan as a consultant, and then I went back to med school. So.
Wow, okay.
Yeah, I just moved around a lot.
And then where did you do your residency?
Oh, everywhere. Initially, I did it at Graduate Hospital in Philadelphia, moved to Morristown Memorial Hospital in New Jersey, the bariatric fellowship at Temple, and then...
Wait, what kind of fellowship?
Bariatrics, weight loss.
Bariatrics? Oh, you were doing the bariatric surgeries?
I love that. Like, I was like, oh my God, I see people who couldn't lose the 500 pounds after surgery become 250. It's like, okay, this is... I can make it, impact in people's lives and make them feel better, because it was a happy story. Like
Yeah.
those patients will come back a year later and go, my knees don't hurt anymore. My joints don't hurt. I can
Right.
hold my babies. I can enjoy the walks. I'm like, yeah, this is what I want. And then,
5 years later,
huh?
5 years later,
But, a couple years later, I realized,
Yeah.
man, I like vascular more. It was so much fun. I was so good at it.
yeah. Well,
Yeah.
I sent a lot of people for bariatric surgery. As
Oh,
a
yeah?
cardiologist, I was surprised how many times I was the first one to recommend it. You know?
Really? Their
Yeah,
family
I was
doctors
like,
don't
honestly,
recommend it?
like more than half the time, I would be the only doctor that brought it up.
It should be
You know?
more widespread knowledge. I mean, sometimes their diabetes is cured, hypertension
Oh
gets
yeah,
better.
It's a no-brainer, but it is a big surgery, so that's why
It is.
I wasn't like on board 100%. But what's interesting about that is, so Ozempic is now the biggest fad with weight loss, and it seems to have good outcomes. Now its indications have crept into the cardiovascular, and I think renal has an indication. So when we say indication, we're saying that insurance will approve patients getting prescribed this, which is a huge thing, right, Dr. Kim?
Yeah,
If
absolutely.
someone's insurance covers something, and if it doesn't, it's like the difference between it happening and not happening, right? For almost everybody.
Yeah, I mean, especially expensive medications, people can't afford that.
One second. I have someone knocking at the door. 1 second.
Yeah, I mean, if the insurance covers it, great. Otherwise, yes, bariatric is, it has dangers. Obviously, you can have a leak, you can have complications. But what's the alternative? Alternative is living another 20 years, damaging their coronary arteries, damaging their knees, having to get knee replacement surgeries, hip replacement. Those orthopedic surgeries are not easy either. They're not safe. You get air embolisms, you get infections. It's dangerous.
No, I mean, it's like, I don't know why, but we never really, maybe we couldn't articulate before how dangerous, or how, maybe we didn't know how bad being obese was, because being overweight used to be like the standard of wealth and everything. And then there's been like a whole revolution of like with food, what's available to eat, Yeah.
So when did you start getting into fitness?
Oh, fitness. Yeah.
Yeah.
So fitness. So my family, I think my father played sports, and so it was like a family creed, to play sports. Since with high school sports, with junior high sports at school, and just played a lot of sports. And then when I was like 17, I really started getting interested in lifting weights. Okay, it was when Vic Tanny's. Remember Vic Tanny's, that chain?
No.
Well, it was something, then it became something, and then it became LA Fitness. I forgot what they were, but it was like, because this whole fitness phenomenon, it really like a lot of people, I was inspired by Sylvester Stallone and Arnold Schwarzenegger, that whole generation, and honestly, they turned out to be right. You could see athletes and everything; they all burn out, and this sport will lead you to require this, but apparently lifting weights keeps you healthy, and they all look good. All these actors look really good, so there is something to it. It's not just an aesthetic thing,
as long as it's not taken too extreme, like
of course.
Ronald. Those guys are too extreme, and now they have complications and liver damage. We're not talking about that.
Extreme bodybuilding is really problematic.
We're not talking about that. We're talking about healthy lifting for
right. Exactly. Yeah. So but the interesting thing about weightlifting is that I started it young, but it remained with me no matter what thing I was into. Like I was into basketball in my early 20s. I still lifted some weights. I was into soccer maybe in my 30s, like with leagues. I had a bigger social circle. I still did weights. So weightlifting was always there. And then over the years, you know how it is. You refine your technique. Like my workout now doesn't need any cardio for my purposes. I work out in such a way to keep my heart rate high. It would be like going, I saw this chart before, like orange, red, orange, red.
Yeah.
And then that's how my workout is. It's orange, red, orange, red. I'll come down. Like I have like a whole way. And a lot of it, actually, you build up conditioning because of the way you breathe. And there's a lot to nasal breathing. Like, in fact, we could talk about that next time. That is like a whole thing. But yeah, so I've been able
sort
to
of like
that.
You configure your weightlifting to be more of an interval cardio training.
Interval. Yeah, I saw you did legs today. So do you do like a dedicated leg day?
Yeah, I do leg
once a
day,
week?
shoulder day, chest day, back days.
Yeah. Yeah, so I do that obviously when I'm like lately I've been doing more total body when I go. You know what I mean? I'm not trying to tune up any particular, like I like the way I look, but I just want to, you know how it is when you lift, it's like a double-edged sword. You feel great, but if you don't lift, your body's like, get back over here. Like you don't feel good when you're not lift. When you know what I'm saying, right?
Yeah.
The only time you don't really feel good is when you haven't lifted. Like you're like, oh man, you got to go get those kinks out. You know what I'm saying?
Yeah, I feel kind of sluggish, not energetic. Yeah.
Exactly. But if you do it just like as a discipline thing, you just go and it'll be part of your routine. It's not even I'm going to work out. It'll be like, this is my routine. Part of it is working out, you know. Sometimes it happens in the morning. Sometimes it has to happen in the evening or whatever. I think when people are like, I'm going to start working out tomorrow at 5 a.m. and they're like, they're going to do this.
It fails.
It just makes it unattainable, you know.
You know, I read this good book from called Atomic Habits by James Clear. It talks about building habits. You start slow and small, meaning like that guy with the heart attack that's 29 years old, he shouldn't have just started working out like that.
Exactly.
He started with slow walking, something gentle, progressive improvement, not just like,
right.
damn it, I'm so, you know, I think a lot of us have that problem too. You know, me too. I'm not immune to it. It's like, God, I'm so sick and tired of where I am. I'm going to make this dramatic change and tomorrow work out 10 hours a day. No, that's when I get a heart attack and hurt my joints.
Yeah.
I do about 2 hours of weightlifting about 5 to 6 times a week. And I haven't gotten to this overnight. I built it up. Initially it was like,
that's actually a lot, dude.
It is.
2 hours,
but initially it was an hour.
Days a week. That is a lot.
Yeah, initially it was an hour, just a couple times a week.
Would you get any like joint aches, any like vertebral aches, anything? Because I feel like if you're working out that much, you're gonna get some structural arthritis, anything like that.
With the free weights I used to. With the free weights of free squatting and bench presses and things like that, I used to. Now I switched to just machines, no pain whatsoever.
I see, because the machines have a limit. Okay,
yes,
so
the stability.
This is good. This is a good thing. This is a good thing to bring up. So remember when we're working something out, there's the physiologic limit, you know, and then there's the anatomic limit.
Yeah.
So if you go past the anatomic limit, you need a surgeon. You ripped something, you broke something.
Oh,
right.
I see. People get that.
So when you're doing free weights, that was the advantage, is that, you know, you can get closer to the anatomic limit, and you know.
But
whereas
your joints and tendons and ligaments.
No, you're right. That's exactly right. So I was asking the question in that way because that's what I've noticed. Is like, I've never really, like, my muscles are never, not that I'm like a big muscular guy, but like my muscles are rarely ever sore. Like I'm barely ever sore. The only thing that's ever really sore is like maybe my spine sometimes if I slept wrong, or like more griddle stuff, you know? Not muscular stuff. And I work out a lot, like not as much as you, but I work out a lot, and it's never like an issue.
Well, you know, I didn't always work out like this. You know, there was a phase in my life where I used to smoke, drink all the time, and I was like,
you used to smoke?
Like, I know.
Oh my God, that's hilarious.
Cigarettes a day, and it was the hardest thing to quit. That's when my cholesterol level was high.
Did your parents know that you smoked?
No, of course not. But I didn't care. But I mean, the point is, I went through that phase, and I realized how valuable it is to be able to work out and keep my body healthier. I don't get sore. My muscles don't get. I don't get to that part. I mean, I'm not doing it to like compete in the bodybuilding, because I want to maintain it. I want to feel good. I want to have a healthy life. I don't want to get cancer. I've seen enough sicknesses and diseases.
Exactly.
That it's like, yeah, man, it's not worth it. I just need to put in my work to prevent that.
Yeah, it's there's so many positives to resistance training, to maintaining your muscles. I mean, it's like an extra reservoir for glycogen, which is like a whole other thing. If you have a lot of muscle, it's going to more likely prevent diabetes because you have more glycogen reserves. So, and then you can have more parts of your body that are less sensitive to insulin, which is like the problem with type 2 diabetes, is that they become insensitive because there's so much sugar all the time. All the cells are messed up, and
have you also heard
resistance training, all that's going to get sucked up. What'd you say?
No. Have you also heard about how the muscle mass helps you to dissipate the any kind of toxins that we ingest daily?
That would make perfect sense. That would make perfect sense. So is this like in the bigger muscles that they saw this in?
Right. So basically, like people with a lot of fat deposits, the fats just simply store, toxins, oxidants, and whatever it is. Whereas the muscles just break it down and pump it through. So so the idea being it keeps you healthier. The muscle mass kind of keeps you healthier.
Yeah, of course.
In addition to being more functioning, more flexible, like enjoying your life more.
More mobility, which is what we started talking about, right? And the natural conclusion would be like one of the worst ways that people pass is from a fall, right? Is all the time. that whole paradigm of relatively healthy person, but not kind of brittle, not a lot of muscle mass, falls. They break their hip, they get an infection, and that's not an uncommon story, right, Dr. Kim?
Oh yeah,
they die that way.
And then they just deteriorates. Their GI function deteriorates. They get they get pneumonia. It's like one thing after another happens.
Yeah, exactly. Just from the fall. So it's not hyperbole to say that movement is life, and you have to maintain your muscles to move. They'll protect you when you fall. That's a good place to end it.
Absolutely, sounds good, man.
Do we have enough content?
Yeah, no, absolutely. Yeah. Well, let's start with this, and then let's think about another person to kind of invite, and then
I have another one we can invite. We can invite digitally. Let's think about what we want to talk about this week. Text. And then maybe I'll think if we decide on something and I can bring someone that can help, I'll ask them.
I'm also going to invite some business leader to talk about medical businesses or whatever it is.
Then I'll just sit there and take notes. That would be good for me. So
okay, man.
Let's do it.
Sounds good. Hey,
that would be very. Actually, I wouldn't mind just talking for an hour about that. That's just fascinating. That's a huge story. There's actually nothing on YouTube like that.
This is easy. Or we can meet and have a drink.
And I'm sure there's transferable lessons to other industries. I'll tell you, I thinking about this made me realize that, let's say I'm suddenly enthralled in some industry, being more knowledgeable of the business world will make me more able to like engage that industry.
Yeah.
Whereas the doctor would have never even known about this.
Right.
You know what I'm saying?
Be more than just doctors. We got to know the law and the taxes and the business.
Yeah, we got to be Superman. Again, we have to drop the mic again, I guess. You already did it, though. And you'll tell us about it.
Sounds good, man. Good talking to you. I'll
All right.
catch you later.
Take care, bud. Have a good week.